Next chapter after the Supreme Court decided to overturn Roe versus Wade. Both abortion rights supporters and anti-abortion rights activists were outside the high court again. You can see them there. Both groups wanting an answer to this simple question. What happens next, especially when it comes to how our region responds to this life-altering ruling? Currently, abortion is legal up to 25 weeks in the Commonwealth. Governor Glenn Youngkin says he wants to lower that to 15. And this has sent abortion providers and patients scrambling for answers tonight. Our Megan Rivers spoke with leaders at Falls Church Healthcare Center. And Megan, they say their phone hasn't stopped ringing since Friday, right?
Yeah, you're right. They've told me that they've had a ton of calls from patients asking about their appointments. Leaders there are focused on health care, even though the clinic was founded in faith.
When people think of this as a religious issue, people are just thinking about one specific religious expression. And it's important to realize that many other different religious expressions exist that do support abortion access.
The debate continues. With abortion rights no longer being federally protected, Mike Scheinberg, the development director at the Falls Church Healthcare Center, says religion is often at the center of this discussion.
Our owner and our director founded this because this is something which she felt was really dear to her faith. You have many people of faith who also feel that abortion should be legal in most or all cases.
He says since the ruling came down on Friday, some patients have been concerned whether they'll be able to keep their appointments.
Patients are calling in asking if this affects them, if we still have their appointments on. The answer is yes.
The Supreme Court ruling sends the power back to states to determine whether abortion access will be available. Virginia Governor Glenn Youngkin has called for a law to ban most abortions after 15 weeks of pregnancy. But as of now, Virginia law permits abortions up to about 26 weeks.
It's also just really a health issue. It is safer for somebody to terminate a pregnancy than to carry it to term. And with our country, and especially in certain cases with maternal mortality, this may be the best option for some people.
Statistically speaking, Scheinberg says abortions are common.
1 in 4 women in this country have abortions, and they have it for very different reasons. For some, it may very well be an incompatibility with life. For some, it may be a financial decision.
And that as long as they can legally provide services, they will do so for any woman or person who chooses to make that decision.
Yes, we are serving patients from Virginia and beyond. And it is legal for us to serve patients from Virginia and beyond in our center.
Now, if you have more questions about abortion rights in our area, you can head to our website right now. That's WUSA9.com to read more information. In the studio, Megan Rivers, WUSA 9. I'm
sure a lot of folks will have many questions in the months ahead. Megan, thank you so much. And you know, after the court overturned Roe versus Wade, 80 prosecutors from across the U.S. released a statement saying they will not use their resources to, quote, criminalize reproductive health decisions. A handful of those prosecutors are in Virginia. They include Steve Descano, Commonwealth's attorney for Fairfax County. On Friday, he sent out a tweet that reads, "The news out of the Supreme Court today is saddening but hardly surprising. No matter what the law in Virginia says, I will not prosecute a woman for having an abortion or for being suspected of inducing one."